Fellow South Africans, yanibingelela nonke egameni lohulumeni wethu waseNingizimu Afrika.
The South African government has imposed new restrictions in an attempt to stem a sharp rise in Covid-19 that is ravaging the country's economy heartland. The wave of infections has been driven by the spread of the more transmissible Delta variant, weak countermeasures, and public fatigue with existing restrictions. While speaking in a televised address to the nation, President Cyril Ramaphosa said additional restrictions are necessary. The president noted further that the focus of his administration is on limiting social contact while preserving the economy.
As a country, we have faced two devastating waves of coronavirus infections. We have overcome these by responding swiftly and decisively and by acting together to contain the spread of the virus and to protect ourselves, our families, and our communities. We now face another great challenge, which is another hill to climb. 12 days ago, I addressed you, and then I did warn that a new and deadly third wave of infections had begun in a number of our provinces and was spreading. The average number of daily new infections was more than doubling, hospital admissions were rising, and deaths from Covid-19 were increasing by nearly 50%. As I addressed you this evening, the situation has gotten worse. Along with many other countries on our continent, Africa, South Africa is seeing a massive resurgence of infections.
Cyril Ramaphosa said all gatherings, indoors and outdoors, would be banned for 14 days, along with the sale of alcohol, dining in restaurants, and travel to and from the worst-hit areas of the country. An extended curfew would also be imposed and schools shut early for holidays.
Will continue to be permitted, but attendance may not exceed 50 people, and all social distancing and health protocols must be observed. Night vigils, after funeral gatherings, and so-called after tears gatherings are not allowed. Public spaces such as beaches and parks will remain open. However, no gatherings will be permitted at such places. A curfew will be in place from 9 p.m. to 4 a.m. and all non-essential establishments will need to close by 8 p.m.
While commenting on the recent surge in infection rate, South Africa's acting Minister of Health, Maloko Kubai, expressed her worries about hospitalizations, which is putting a lot of pressure on the country's health facilities.
Our scientists, after their sequencing experiments, have discovered that we have a new variant that is prevalent in our country. This new variant is called a Delta. You know that it's not a new in terms of existing only in South Africa. It exists in other countries. Nationally, the numbers have surpassed the first wave peak, and we are likely to surpass the second wave peak. We remain very worried about the rise in the hospitalization, which is putting a lot of strain in the health facilities in Gauteng.
South Africa recently received 1.4 million doses of the Pfizer vaccine via the COVAX facility and an additional 1.2 million doses of the Johnson & Johnson vaccine. So far, the vaccine rollout in South Africa has been slow, with only around 2.7 million doses administered among a total population of 60 million. Faced with opposition protests, the government has set a target of more than doubling the rate of daily vaccinations over the next month. Kamel Sadiq reporting for CBA TV.